The current state of the NHS is a big question. Clearly there are lots of challenges on it. The good news is there's masses of public and political support for the National Health Service at the moment. That seems to be rock solid, looking at the long run graphs of British social attitudes or Ipsos polling, for example. I think the prospects are good, but there's masses of challenges, as we all know. Obviously, the big challenges ahead that need to be cracked include all the new things that are going to rein in on the health service, from new technologies to big tech becoming much more active in helping us stay healthy, and how that will influence demand on the health sector. Also, the NHS has got to be very much more used to dealing with shortages, particularly workforce shortages. In future, we know that 1 in 8 staff we're short of at the moment, and therefore how we can do more with less and take care of staff is another big challenge. Only if we do those things can we even think of sustaining the NHS. Well, I think 2 things I would point out. I think, well, maybe 3 things actually. The first one is to work much more fully with patients, because patients will hold the key to their future health than we have really taken cognizance of in the past. That's one. Another is the need for constant change, to seek every day faster discovery of improvements in all that we do at the front line, whether we're right in the intensive care unit, whether we're in primary care, whether we're out in the community, in community services. And I think the third big area is working across agencies far more, with a diverse group of people, with diverse cultures. That's in the agencies that they have to deal with. So public sector leaders are going to have to operate differently, not quite so rigid, taking into account different voices, operating across different cultures. And I think that means multitasking, being more tolerant, open, but yet also always focused on the right thing, which is doing the best thing for patients, and of course the most efficient thing too. So I think less rule-based and much more in the moment and plural, and how we train, that's the big task, but that's the challenge ahead.